Good morning, 101 Country, WBDC, and for those watching on 18 WJTS, I'm Kaitlyn Neukam, and we are here to talk with some community members, of course, about Suicide Prevention Month. Thank you both for coming in. We have Janet Schnell and Jessica Miller here. Janet Schnell, of course, from Survivors of Suicide of Dubois County, and Jessica Miller with Rooted Counseling and Consulting. Welcome back, ladies. It's been another week. We are back to Tuesday, and we've got a lot to talk about, but of course, thank you for being here.
Thanks for having us.
So first off, of course, we want to discuss a little bit about World Suicide Prevention Day, which is today. It is Tuesday, September 10th. It is from the World Health Organization. And of course, the first thing, their kind of like message, their goal of this year's campaign is changing the narrative of suicide. So Janet, I really want to go to you first, and really, this is a part of your changing the narrative on suicide, is talking about it and discussing these things with people at home, in their cars, everywhere that you can to spread awareness. So what does that mean to survivors of suicide, as well as, just what are you guys doing this year to kind of promote that?
Well, actually, this has been a great transition. This year, the national strategy just recently was released, and the biggest change that I've seen is that they are asking for lost survivors and people who've had an experience of an attempted suicide to actually weigh in on policies to make some huge changes based upon our experience. And so they're really valuing the people who've been in the field, who've been here. We've been here since 1996, to say, what have you learned? Because these are the things that we need to start incorporating here in our communities.
Right, and honestly, it is it's one of those tough topics to talk about, but that's why we're here. That's why you guys are coming back this month for Suicide Prevention Month, and you're really just taking that stigma and taking the stigma away and making the awareness even more important. Jessica, World Suicide Prevention Day. It's been a year, and you were in last week to talk about various things. The call to action, what maybe with Rooted Counseling and Consulting, or just in general, you guys really prioritize and promoting this month to really get the word out?
So we are always about prevention of suicide. If you're noticing warning signs, you're lonely, you're depressed, you're not getting out of bed, you're not finding joy, make those connections, get connected with your family, with your friends, with a therapist, and let's start talking and let's make change.
Right. Very good. Yes, it's to suffer alone is never a good thing. So just really raising your voice and being the change, whether it's for a family member or a friend, that is just very integral. So we are definitely going to continue our talk about warning signs and coping and all of these things. So just things that people can use to benefit themselves, to feel less alone, less just stuck in this fight. So, Janet, what are some things to kind of, we briefly talked about it last week, and we want to talk about it again this week, more warning signs, more coping skills, and all of these things that people really need to look forward to, or just try to prevent. So can you give us a little bit of a better idea on that?
Actually, I wanted to even add in a little bit to what Jessica had said, that so many times people were like, oh, if I talk to my friend, that's good, that'll be fine. But counseling is a little bit different. You're actually talking to a trained professional who knows different types of techniques to be able to help you. And so it's more than talking to a friend. So talking to a trained mental health provider can help you figure out what's the next step. What do you need to do to help so that you don't feel that emptiness, that loneliness, because we tend to isolate. We tend to think there's a very big misperception that mental health providers don't get it, that there's no help, but there is. That we're specially trained to be able to provide services to look at different types of therapy to help you get better. And so when we look at isolation, we need to figure out what do we need to do to stop the isolation. Part of the isolation would be to, we look at different types of how to get connected again in your community. We do suicide prevention training with local faith-based communities, because that's one key area that we'll notice is if someone is depressed and they're starting to isolate, they stop going to church. So how do we get the churches involved to bring that person back in? Because that will help a great deal with depression.
Definitely. And, Jessica, as a licensed therapist and someone who deals with these people in a more intimate setting, I would imagine you see a lot of this, and even people come to you when they themselves realize that their daily habits and their schedule and whatnot, it changes and they make themselves a bit more isolated. So will you talk on a little bit of maybe what you see on an individual level that people can look out for, whether it's personally or again, just those things that people need to just be aware of just in case?
I think one of the biggest things that I see that brings people into my office is maybe their spouse or their closest friends are saying, hey, Susan, you're just not yourself. Like, what's going on? You used to do all of these things. We used to do these meetings, or we used to go bowling, and you keep saying no, or you haven't been out of the house, you haven't taken a shower. Like, what's going on? And they get into my office and they're like, I don't know what's going on. And it could be anything. It could be a big event. It could be your child has now gone to college, or they've gotten married, or now they've got kids and they're not communicating with you. Small changes too. It could be anything. And you sit in my office and you're in the chair across from me and we're just talking. We're looking at your patterns of thought. We're challenging those. We're changing the way that you're thinking. We're looking for things and we're just doing it differently. We're looking at how you can change one thing and see it in a different light.
Right, and changing the perception and just changing the negative thought patterns as an individual, and being able to share that with whomever you need to is super, super integral. And again, just changing the way you think about these things, because when you get in that negative space, it is so, so difficult to think any other way. And knowing that there are options and that there is help, whether individually or in group or anything, it is there.
Yes.
So, Janet, tell us more about, we're in Suicide Prevention Month, and there are still always resources for people to take advantage of. So what can we kind of expect with that?
Well, just to know that there's resources here, mental health providers here in Dubois County and the surrounding counties. And so if you need that resource list, we're more than happy to share that with you with survivors of suicide. There's other things that we can also do to take care of ourselves besides going to counseling. We have coping skills such as doing some deep breathing techniques. And so I'm also a licensed clinical social worker, so I've done some of this with my patients. But if we can't meet face to face all the time. Maybe you wake up at 3:30 in the morning and you just can't go back to sleep. Your mind is racing. We practice some deep breathing techniques, which has been very beneficial. Usually what I do is I'll start off and say, pick a shape. What shape do you like? If it's a triangle, a square. And say if it's a triangle, you start at the top. And when you slide down, it's you're breathing in. And then at the very bottom, you're holding your breath, and then you're breathing out when you go back up. You're breathing through your nose and exhaling through your mouth. Do this in succession for at least 3 times, and it seems to really help. It calms the brain down. So that's one easy step that you can do, a coping skill that you can do to help not feel so anxious and maybe clear your head.
Definitely. And Jessica, I would imagine, again, you deal with so many different clientele with your counseling services. Is there anything, meditation is a fantastic start. I know just being mindful and taking that minute or 2 or 5 or 10 minutes to just dedicate to yourself and being mindful can be very, very difficult. You give yourself all these excuses to not do it, or, I don't have time. But is there anything else that people should really try to take into account for if and when and how they need to practice mindfulness, or again, just taking that deep breath on a personal level?
Mm-hmm. So one of my favorite things to teach even my kiddos and my adults is 5, 4, 3, 2, 1. 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, 1 thing you can taste. It could be in any succession. I always say do the taste last because you don't want to be licking windows. But 5 things, 4 things, 3 things, just to become present in the moment. Another thing I like to teach them is biohacking. Your brain can only handle 1 crisis at a time. So if you introduce a new crisis, like something super spicy or something super sour, your brain is going to forget about whatever it was freaking out about. So if you're freaking out about, I'm going someplace new, pop yourself in a warhead. It's going to forget about what's going on.
I like that advice, because honestly, if it's too spicy or too crunchy or something, make that sensory overload in a good, different sense. Because again, if you just overthink it and you get too much in your head and no one's there to talk you through it, or you're already past that point, doing the sensory thing, or just I think my personal experience, just going out and putting your feet in the grass and feeling that sensation to ground yourself in the physical ground.
Yes.
There's so many different ways to kind of really just, settle yourself down and calm yourself. Janet, I want to talk a little bit about maybe, whether you are facing those difficulties right now, or maybe you are not necessarily in that space, but you might eventually reach somebody that really is struggling or whatnot. Is there any type of way for people to get involved with community suicide prevention today, or in the next week, or in the next month, where they can really, take a little bit of skills, and if they find that it'll be helpful to someone down the line, they can really just grow into that? Or maybe I want to say just kind of dip their feet in, especially now that we're in Suicide Prevention Month, and it's super important to get started now, sooner than later.
Right. Yeah, we here at Survivors of Suicide actually offer various trainings. One is QPR, question, persuade, and refer, where we can walk you step by step through suicide prevention, and we actually teach how to do the open body stance, of how to listen to someone so that they know that they're being listened to. And so we can provide that in 1 to 2 hours. We also offer other trainings, such as the Columbia Suicide Severity Rating Scale, which actually helps for someone. You're talking to someone, you're not sure what you need to do. Do you need to take them to the hospital for an assessment? Do you need to make an appointment with a mental health provider? We can walk you through that also. It's a very easy form anyone can use. It just needs training so that you know the words to ask. But we have an ACEs training, is also a really good training that helps to understand why kids behave the way kids do behave. And so that it's not that they're wanting to misbehave. Many times it's because of trauma. So we have a lot of different types of trainings that we can offer, again, free to the community. And so just let us know how we can help. But what we know through evidence-based is that, first, all the programs are programs that are evidence-based. But we also know that when you are trained, you're more comfortable talking about suicide. As you had mentioned earlier, that suicide can kind of be scary. When you're a lost survivor, it's not as scary as it was before. Mainly because we lived through the devastation, and our goal really as lost survivors is to not see another suicide death. And so what we want to do is be able to reach out to the community to help prevent suicide. And through training, we've seen a lot of success, especially here in Dubois County.
Right. And Janet, on that as well, I want to really hone in and highlight the idea that all of these certifications, all of these courses, and all of these training sessions, it does not matter where you're coming from. And if you want to put in the time, the dedication, and learn about these and really become more adept in these situations, you can come from any walk of life, so long as you're able to really take this in and adapt, right? Even Joe Schmo listening to this at work, he can if he finds an interest to it, he's able to grow. And it doesn't matter if you have a certification or not. You guys are taking in anyone who's willing to help someone in the future, or even themselves, right?
Right. We're called gatekeepers. Gatekeepers are the people with the boots on the ground, the people that you see daily, the people that you make connections with. You're the first line of defense. You're the first person to get someone help. That if they're depressed, they don't come to a mental health provider first. They have someone, a loved one, someone who cares about them, who identifies first. And so that's our gatekeepers. They're the people who are the most important change that we have in our community. Very vital.
And gatekeepers in a good way. You guys are here to be the point of contact that spreads the word, and it makes everyone a little more aware, right?
Correct.
So, we've talked about a lot of different things today, and a lot of different topics and resources, and just ways to calm yourself down, a walk, all of these things. Jessica, will you give us a little bit of a summary of maybe some resources that you suggest to clients, or again, just things that people, if they have been listening, maybe now is the time to get out your phone, open the Notes app, and really just take into account what you might need in the future?
So I have a couple apps that I really like to refer to my patients and just community members. This is not sponsored. I don't get paid by them. Calm, love it. I've had the paid subscription for at least 10 years. Absolutely love it. Totally worth the $68 a month or $68 a year. It's got meditation, can help you sleep, help you through anxiety attacks, help you through meditations, all of that. And then Mind Shift is amazing. It's got some cognitive behavioral techniques. It's got anxiety reducing techniques. Also got some meditations. Top 2 best apps ever out there, in my opinion.
Yes, of course. And again, it depends on who the user is and what you're really looking for in an app. I know as far as my Apple consumerism is, they have an excellent selection on the App Store about mental health, growth, and learning and all of these things. So having those resources at the touch of your fingertips is super important. And then, Janet, will you please remind us of what we have locally and maybe nationally about what we can use in case we need that extra help?
Well, first off, we have to remember we have 988, our 3-digit crisis line. And crisis can be for if you're worried about someone or yourself are struggling. And that's a 24-hour, 7-day-a-week resource that you just dial 988. They actually have separate lines for veterans. They have a separate line for Spanish speaking. They can also text. So it's a wonderful resource. Here in our own community, we have Memorial Hospital with their emergency room that you are really worried about someone. You can take them there to have them be assessed by a mental health provider who's specially trained on to figure out the best services for them. We also have Life Springs, our community mental health agency, also has a hotline number that you can call in there. Memorial Hospital also does. And they can provide a lot of really quick resources. If you're worried about someone, they're having thoughts of suicide, make sure that's clear in front. Because if you're talking about suicide, it's very different than maybe saying that you're kind of struggling, but you'd like to have some help. Suicide actually takes it up to the next level to say that, okay, we need to get someone in very quickly. We need to address it right now. And so we also have many different agencies here in our community, Piece by Piece. Jessica, help me here with some Creative Thoughts.
We've got Navigate Christian Counseling.
So we have a lot of different independent agencies also, along with Rooted Counseling again, that we can have different resources. And that's just here in Dubois County. We also have others throughout the county because sometimes people prefer to maybe go to Evansville or because of the being able to be anonymous. And so we have those different resources. We have lots of help. We have people who are really caring. They do get it. And I think that's the part that's most important, is that mental health providers do understand about suicide and suicide prevention, and they're here to help.
Yes. And one thing I would like to add is if you don't mesh well with one therapist, it's okay to find another one, because I'm not the best therapist for one person, but my friend Kara might be the best therapist for you.
I love that you added that. Truly just, they understand, and it is okay to reach out for multiple avenues of help. Again, people hear this, and hopefully they will really take this to mind to put that foot forward. Ladies, it is Suicide Prevention Month. You will be back here again next Tuesday and the following Tuesday, or that you will send some of your fantastic representatives. Is there anything else you want to make sure to mention for this week? Because you have a lot of ground to cover, and the month is not yet up yet. And I want to make sure we kind of move on, but at the same time, all of this is super important, and Survivors of Suicide's work is never done, as well as Rooted Counseling and Consulting. But anything else you want to make sure to mention today?
Only thing I would like to mention is that even if you don't feel like it, you do matter and you are important.
Very good. 988, of course, is the National Suicide Prevention Hotline number. Janet, Jessica, thank you so much for coming in and talking with us once again today. We appreciate your time and all the great work you guys are doing during Suicide Prevention Month in September here for all of Dubois County and beyond.
Thank you.
Thank you.
Awesome. You have been listening to 101 Country WBDC with National Suicide Prevention Month celebration. Today, of course, is the World Suicide Prevention Day of Tuesday, September 10th. I wanted to say Saturday. Tuesday, September 10th. You've been watching on 101 Country WBDC and 18 WJTS. Thank you so much for listening. I've been Kaitlyn Neukam, and back to the tunes.